Hi guys, it's Alan here, Alan Bryden, optometrist at Bryden Opticians and owner of the practice. Now you find me sitting right in the actual testing chair that any patient that comes in here in order to get their eye test has to sit in. Now some people are quite apprehensive sometimes coming to get an eye test, but there's absolutely nothing to worry about. It's a very relaxed environment and very straightforward process to get your eyes tested. So I'll just take you on a little bit of a run through to just explain exactly what we do, I suppose. So hopefully you've been to have your eyes tested before, either with us or somewhere else. And you know, an eye test itself, first and foremost, we need to kind of break down exactly what your main needs and wants are from your eye care. If you need to wear glasses, if you're having problems with your eyesight. So we ask a series of questions in order to get an idea of what exactly it is you're having an issue with, or what we could maybe, the problems that we could potentially solve using glasses or contact lenses for that matter. So firstly we'd ask the questions, then we kind of proceed to checking your visual acuities or your eyesight, and on that we would use this chart above. This is a projector chart. I'll turn it on and it projects letters onto the wall straight ahead. So it's just straight in front of my face, and it's just a simple matter of reading the actual letters. And in doing that, we then check with your glasses, without your glasses on, if you wear glasses. And from that then we would use these little lenses over here. So we'll check for your prescription. So using these lenses and using these really attractive looking glasses, we'll put those on and just check for your prescription. In doing that too, we've got a few bits and pieces of equipment here. This thing here is called a slit lamp. And it's something that we use very frequently, well, pretty much on every customer, every patient that comes in. It's essential to use that to look at the surface of your eye and to look into the back of your eye to check for any eye health problems. This machine here right beside is called an autorefractor. Again, you would pop your chin on the chin rest, look through here, and it basically gives us a very accurate kind of estimate of what your prescription is for your glasses. And it would be from this result that we would then put these glasses on, and then using these lenses, based on your responses to the letters you're seeing, among other bits and pieces that we get you to look at, we get an accurate reading of your prescription. And thankfully, been in practice now for nearly 12 years, our prescription accuracy is very, very high. It's, you know, up there 99 point something percent, I would say. So thankfully we never have too many issues with that, which is, even if I do say so myself, but that's something we pride ourselves on. This little machine behind is called a pulsator. So it's something that actually checks the pressure inside your eyes. You can probably see a little red light there in between the two green lights. This is basically checked one eye at a time. Usually on average, a standard, anybody over the age of 30 gets this little test done, and you can probably hear a little puff. So it's held in front of each eye and it checks for conditions like glaucoma. It just gives us an estimate and an average of the eye pressure in your eyes. So it's another essential part of your eye care health check, so to speak. So that's just a general overview. There's so many other bits and pieces that we still and would use within the eye test when needed. So we tailor everything specifically for you, the individual, because nobody's eyes are exactly the same. Everybody's unique, everybody's different. So we would go through that whole process on pretty much everyone. If you've got children, normally the pressure test doesn't be done. So don't be worried if they're watching this and maybe that puts them off, because this is the one thing that gets most people as far as they don't like having it done. But it's very straightforward. It's literally a split second and it's done. And this one's quite gentle. Some of the other ones are maybe a little bit harsher, but this one's quite good. So that's just a general overview of what our eye test consists of, what our eye test ocular health check is. We have other machines as well that we use for certain conditions. This is a visual fields machine. If we need to have that done, we would put you on that as well. And if at any point there's any issues that we detect, if we discover there's something happening at the back of your eyes or something that you need further assessment for, we would refer you to the specialists at either OMA or Alton Gelvin, and they would take on your eye care needs from then. So I hope you found that useful. If you have any questions, feel free to contact us. Go to our Facebook page, Bryden Opticians, give us a like, follow us on the page. We're quite active there. Or we have an Instagram account as well, so you can follow us there. But if you want to contact us in either of those or any of those platforms, or just give us, with the old-fashioned way, a little phone call, it's always good. If you have any questions or if you want to make an appointment, call us on the number above. So thanks for watching. Hope you found it useful. Bye-bye.